Have you ever wondered what is the reason that your blood glucose level is always high? You are taking your regular medicine which is prescribed by your diabetic doctor, but still your blood glucose level is very high. Some people think that diabetes is very easy. It rises only when you eat good food, carbs and sweets, and you can control it easily with the medicine. If you take medicine, it will come down. But is it true? Let's talk. If you are non-diabetic and you are taking your favorite breakfast every day like tea with toast and biscuit, then be aware. You might be the next victim for diabetes. Maybe you look healthy today, your glucose level is normal, but have you checked your fasting insulin level? If you are in your 30s or 40s, go and check your fasting insulin level to check the possibilities and risk of diabetes. About fasting insulin level, we'll talk later in our next videos, but you should know one thing. If you have high fasting insulin level, you are progressing towards diabetes. Some of you might be thinking, is diabetes reversible or we can treat diabetes? So this is the good news for you. Yes, we can prevent, treat or reverse diabetes. No matter you are in your 80s or 90s or how much medicine you are taking, yes, you can reverse your diabetes. Let's talk about our first topic. It is low glycemic index food. What do you understand with the word low glycemic index food? Low glycemic index foods are those foods breaks down slowly in your intestine and absorb very slowly in your blood. It helps decreasing your sudden spike of blood glucose level. And the low glycemic index foods, legumes, berries and apples. High glycemic index foods, they are not good for your health, but knowingly and unknowingly everybody is eating those foods. Those foods are like white bread, wheat and rice. Let's talk about our next topic. It is high fiber rich diet. No, I'm not talking about all the fibers you are taking in your food. I'm talking about soluble fiber rich food. Do you know what is the difference between soluble fiber and insoluble fiber? Let's see what are those soluble fiber rich food and what they do to decrease our blood sugar level. Soluble fibers are the kind of fiber which is able to decrease digestion of sugar and carbohydrate from your food to your bloodstream. Soluble fiber starts forming a viscous gel around your small intestine and decrease sugar absorption. Now, where will you get these soluble fibers? We'll talk about it. Some example of soluble fibers are oats, lentils and flax seeds. Some of you may be already knowing that fiber-rich diet also help increasing your good bacteria. Yes, the microbacteria in your intestine. They start forming short fatty acid chains. This short fatty acid chain help in your glucose metabolism and it reduce inflammation in our body. Now we're gonna talk about our next topic. It is exercise and walking. Yes, everybody knows about the exercise and walking, how helpful it is. But are you doing regular walking? What really happens when you walk daily after meal? In your muscle there is a transporter called GLUT4 transporter. This GLUT4 transporter is insulin independent transport, which means it does not depend on insulin to utilize the sugar. If you walk every day after your meal, these transporters get activated and it utilizes your glucose from blood to the muscle directly without depending on the insulin. So now you understand, if you walk after meal, you can decrease insulin spikes in your blood, which also prevent insulin resistance. Control your blood sugar level without taking extra medicines. Please try to heal your body. This formula is very simple. No medicine is needed. You just have to control your mind and your habits. Reverse your diabetes. I see many people who had diabetic complications like heart disease, kidney failure, neuropathy, pain in leg, numbness. I don't want you to go to that level. If you are pre-diabetic and you are thinking that you are out of the risk of heart disease, kidney disease, neuropathies, I want to tell you that in research we found that 50% of pre-diabetic patient has already started developing heart disease. Yes, the person who got heart attack in their 30s and 40s, most of them was pre-diabetes. So go get your fasting insulin level check along with HbA1c level. Diabetes is all about your physical as well as mental health. Lack of sleep triggers your stress hormone, which is called cortisol hormone. Cortisol hormone in a normal person has a specific cycle. It starts rising at peak level in the morning but start declining during the evening time, because in the evening time our body is preparing for the sleep. But if you are having sleeping problem, it might not decreasing in the evening, and in return this cortisol hormone is triggering gluconeogenesis. If you are having stress problem, I will suggest you to do breathing exercise and meditation on daily basis. Avoid unnecessary drama in your life. Stress triggers your hunger hormones as well. Go to bed, make every day sleeping plan at 9 p.m. or 10 p.m. Sleep for 7 to 9 hours. Give your body full rest and wake up fresh. Heal your body naturally. Please follow in your lifestyle and stay healthy.